I've been asked the question, what is my advice to health consumers or chronic pain patients who may have been tapered from their opioids in recent times? One of the things I think it's very important for chronic patients, and myself, of course, is to learn how to self-advocate. Educate yourselves in what is supposed to be happening. Knowledge is power. Beware of your personal rights. I may not have any solutions for you, but these are some of the things that I've done in the past to make sure that I'm able to advocate for myself. I always keep copies of all the documents I'm given. I ask the receptionist at the GP's office if nobody else will give me them. Especially, I'm hearing in recent times about people who had to sign contracts of some description to receive their opioid therapy, or they may be locked into one chemist. They may be chronic pain patients, but in some cases, they seem to be treated like people who've abused their opioids, and they're put under certain legislation whereby they have to go to the same doctor and the same pharmacist. This may not be fair, but you must do what you've been told to do. If the opioid therapy, though, is safe and effective, the only advice I could give, particularly this is what I do, I learn how to speak the right language. I tell my doctor objectively, truthfully, what my current situation is, and I describe my symptoms, and I try to come to a mutual agreement, because it's supposed to be a partnership between the doctor and the patient. If you don't feel confident in doing so, take some notes with you, take a friend, take a relative, take a significant other to any of your appointments where you feel you may not be able to remember the questions or to advocate certain points for yourself. As well as that, when there's big appointments that you have to attend that are important for you or have a little bit of impact upon you later on, learn how to utilize relaxation techniques. I use a lot of tools in my pain toolbox, from stretching, graded exercise. I use heat packs, rest, music, mindfulness, and I think a lot of us use the old pacing technique, which is very important. Also, you can use distraction, music, whatever it is, other activities that keep you calm for these important opportunities where you get to talk with the doctor or specialist. There's a lot of things that can go wrong. And in my closing comment, I'll say treating chronic non-cancer pain with an appropriate dose of opioids is very important. It can be very beneficial when all other alternatives have been used. In fact, Chronic Pain Australia have said recently that the patient should be able to agree to opioid therapy, determine the pace of tapering, decide when to pause, and have an ability to return to an effective previous dose. We must learn to advocate for ourselves. Thank you.